you all for coming today. I hope you're interested and all ready to learn all there is to know about health literacy. To my students, some of this is going to be a refresher for you, so hopefully you'll enjoy that refresher. Okay, so these are the objectives for our short time together today. First, I want to introduce you to health literacy based on the most recent definition of health literacy, because there are a few floating around, but there's one that we like the best. Second, I want to tell you about the impact of health literacy on health and health systems. And then third, we can talk about plain language as a strategy to mitigate the effects of low health literacy and low digital health literacy. Okay, so this is a definition of health literacy that we operationalize and we use in our work at Cancer Education at Princess Margaret. So this is saying that health literacy entails people's knowledge, their motivation, and competencies to access, understand, appraise, and apply health information in order to make judgments and take decisions in everyday life concerning their health care, disease prevention, and health promotion to maintain or improve quality of life during the life course. And this definition takes into account the health literacy level of individuals, of ourselves, of patients, but it also takes into account the skills and abilities of healthcare providers, their ability to communicate using clear language, their time that they take to talk to you, and their whole perception of patient participation in their care or patient engagement. And this definition of health literacy also takes into account the demands and the complexity of the health systems and the health services that patients are accessing. So we know in cancer care, cancer is incredibly complex. I think most people don't anticipate when they get a diagnosis of cancer that they're in for about a year of many different treatments, many different side effects, many very complicated words, all while you're feeling very unwell and probably also frightened about your outlook. So cancer is an incredibly complex health system of an incredibly complex disease. And I think this definition of health literacy appreciates that would be different than potentially what it would take to go to a family doctor. Although finding a family doctor can be pretty complicated too. So this is a framework that was developed by two prominent health literacy researchers, Michael Pash-Orlow and Michael Wolf. And this basically shows the known predictors of health literacy, of an individual's health literacy, on the left side. And that's things like your education level, your age, the language that you speak in the country that you're in, as well as your ability to hear and things like this. These all would influence an individual's health literacy level. But those things are also your own health literacy level, even if it's really high, is influenced by three other things. And those are things like your experience accessing health services, your ability to ask questions, to have the confidence to talk to health providers and get information, the communication skills of the healthcare providers who are talking to you. As well as your ability to self-care. So things like if you had a pamphlet that you were given by a doctor and they said, here's your instructions for bowel preparation before your CT scan next week. And on that piece of paper, it tells you have to fast. It tells you when and how many hours and how to prepare for it. If you dropped that in a puddle on the way home, would you be able to find it on the internet? Or would you be able to find a way to get another copy? And that actually influences your health literacy, because if you can't, then you're not going to come in prepared for your appointment. And all of these things are known to influence health outcomes. So so your own sort of state health literacy, and then a number of other factors come in to influence your health literacy, and all of these things have an influence on your outcomes. So health literacy in Canada. Maybe I'll flick this back for a moment. You may have seen the numbers, but in Canada, 42% of Canadians have low literacy. So that's a low ability to read and write. What do you think the number is if we're talking about health literacy? What percentage of Canadians would have low health literacy, so a low ability to read and write and use numbers in the context of healthcare? So 42 for general literacy. What do you think for health? 50? 50%? Anybody else? It's close. 80? 60? All right. Actually, you're all very close. So It's 60% of working age Canadians have low health literacy. But if we look at people who are over 65, 88% of Canadians have low health literacy. And if we think about the cancer system, the vast majority of cancer patients are older, they're over 65. So we should assume that, and I think we comfortably can assume, that the vast majority of cancer patients have low health literacy. And just something else to take into account, this data comes from the National Adult Assessment of Literacy Skills Survey, which was last administered with the census back in 2009. So this is old data, but I think it's still very relevant today. But that only measured ability to read and write. It didn't take into account health system complexity. It didn't take into account provider communication skills and how that would affect a person's health literacy. This is only numbers looking at reading and writing. So it's actually an underestimation of the prevalence of the problem. So in cancer and the way we operate in cancer education and at Cancer Care Ontario, we assume everyone in the cancer system has low health literacy. It's a safer place to be, to assume that everyone would like information to be simple, that they need help navigating complexity, rather than trying to guess who has low health literacy. So why does health literacy matter? I can see that probably you can't see these slides, so that's okay, I'll read them out. Health literacy, this is sort of an amalgamation of the literature, all of the evidence that shows the impact of low health literacy. So low health literacy is associated with less use of preventative health services. Preventative health services are things like Pap tests, mammograms, colorectal swabs, as well as sunscreen use. So people with low health literacy are less likely to use preventative health services. It also includes family doctors and things like that. People with low health literacy low health literacy is also associated with delayed diagnoses. So people with low health literacy present to the cancer system, oftentimes with more advanced cancers. Not all cancers are detectable, but the ones that are, people with low health literacy tend to come in with more advanced cancers. There's also an association between low health literacy and less adherence to medical instructions, poorer self-management skills and ability to navigate the health system, as well as lower self-esteem for individuals with low health literacy, which can affect their ability to feel confident to communicate with healthcare providers and ask questions and advocate for themselves. Low health literacy is also obviously associated with greater social inequities, higher healthcare costs, and also poorer health outcomes for patients. So it's a significant problem. There's also a significant economic impact of low health literacy. So in Canada, low health literacy costs between 3 and 5% of our total healthcare budget every year. And that's about $8 billion. And the reason for that is things like people not identifying problematic symptoms soon enough that they could be taken care of by a family doctor, so they end up going to the emergency department, which is very expensive, or people who are discharged home from the hospital with some self-care instructions, but they're not able to follow them. Or maybe they don't have the confidence to ask questions and get the information they need to cope, so they can end up back in the hospital, and hospitalization is very expensive. So when we think about Canadian healthcare, we know that the number of cancer patients are increasing. 30% more Canadians will have cancer in 2030 than they do now, and the cancer workforce is doubling. It has to double to cope with this impending increase in cancer cases. We have the same amount of money. There's not more money for Canadian healthcare. So we have to find ways to save money and to do this better and help everyone to have better outcomes. And so low health literacy is actually a really big opportunity to save money for the health system and make more room for more cancer patient treatments. So the field of health literacy until around 2012 focused on the skills of individuals only. They only looked at that patient can't read and write. And what the effect of that was, research halted, because when there's nothing you can do about a problem in the context of healthcare, it's not your problem to deal with. So it was the problem of the education system. But now there's this greater recognition that a person's health literacy is influenced by healthcare providers. It's influenced by the signs in the hospital. It's influenced by their ability to find a pamphlet to get some instructions that they may have lost. And this, of course, is a responsibility of the health system and of the hospitals. So it's become a priority really recently in the past couple of years, which is very exciting for us. So now health literacy is recognized as multidimensional, includes providers, patients, health systems, all of it together, which is a very positive place to be. The Institute of Medicine, now called the National Academy of Medicine, put forth a paper called the Health Literate Healthcare Organization Concept. And this is just talking about, I'm not going to go into detail of this with you, but it just basically talks about, and I hope that after this talk today, you'll think about it too while you're walking around the hospitals. It talks about things like signage. So if you're a patient and you have lung cancer and they go to the lung clinic, do you know what it's called, the lung clinic here at Princess Margaret? The thoracic clinic. So most people won't know what that is. So how are they supposed to find the lung clinic? You know you're either going to get a diagnosis or you've been diagnosed, so you're already stressed out. You have to find the clinic. You probably don't feel well, and you can't find it because you can't read the name. You know, it's a little bit obvious that kind of thing needs to change. And I hope after today you'll notice some of those things around UHN, and we are working to improve them, but baby steps. So that's what the Health Literate Healthcare Organization does. It really highlights the importance of making health organizations health literate. So we have a little bit of a paradox in the cancer system. Cancer care is being mostly transferred to the outpatient setting. In the past, cancer patients would stay as inpatients. They'd be treated, there'd be nurses, doctors looking after them 24/7. Now the vast majority of cancer care happens at home. You come in as an outpatient, get your medicine, and you go home. But patients are increasingly challenged to self-manage their disease, identify symptoms, take their medications properly, communicate with their health providers. But nothing's different in our health system. So they're not being prepared to do that. The system has changed the way they treat people, but there hasn't been a change in the way people are treated. And this is a problem. And so the literature shows you have to have high health literacy to have optimal health outcomes. It's not really fair, considering most people don't have high health literacy. So it results in a bit of a paradox in our health system. So what can we do about it? Patient education is one of the strongest means to reduce health literacy disparities. And there's actually quite a lot we can do. So you can't really see the oval here, but there it is. That's why you couldn't see it. Those black boxes are really opportunities to intervene to improve health literacy in the health system. And so there's actually a very positive story, which is it doesn't take much to actually make a really big difference. And we'll get into that now, but focusing in on plain language communication. And soon I'm going to stop talking and you'll have a chance to talk too. So this is a story I want to tell you about to illustrate the importance of plain language communication. So this is a story that my sister, Tina Papadakos, told me. She used to work at St. Michael's Hospital, and this is something that happened with her. So she had a colleague who was a nurse, a real champion in patient education, really cared about making sure patients understood what was going on. And she told Tina this story. She said, I had a patient. He was coming in for his pre-op appointment, so his surgery was scheduled a couple days later. And at the end of his pre-op appointment, I said to him, I handed him this bottle, and I said, hey, on the morning of your surgery, cleanse your body with this fluid. So what do you think happened? What do you think happened? Drank it? Yes, exactly. So he drank it, and do you know what it was? It was soap. So when he got to his appointment in the morning, the nurse was there to greet him and say, hello, how are you? Are you ready for today? Did you wash your body with that soap I gave you? No, but I drank that horrible drink you gave me. Now, if we think back to health literacy and all of the different impacts of low health literacy, think about this poor fellow's self-esteem. Wouldn't you be embarrassed? So we can see how it links to self-esteem, but there's also other implications. So this minor miscommunication actually had really significant impacts. And there was a cost to the patient, so he couldn't have his surgery that day. So he may have taken time off work, so he might have lost wages. But even if he didn't lose wages, the company he worked for lost his productivity, so that's a loss of income too. There were potentially out-of-pocket expenses, $20 to park at the hospital. This particular fellow also brought a friend with him, so that friend took time off work. And imagine how doubly embarrassed you'd be when you impose on someone to take time off work to help you out, and then you drank the soap. And there's also cost to the healthcare system. So there was an underutilized surgical suite, so that surgery didn't happen. But all of the health human resources, all the staff had come in for that surgery, and they get paid for it. Not the same amount as they would if they had conducted it, but they still get paid. So there's waste human resources there. So when you think about the economic impact of low health literacy, I hope this story will stay with you. So if you're telling someone at a cocktail party or at a coffee shop about health literacy, you can tell them this story and through this story demonstrate the impact to the costs of the Canadian healthcare system. And I think all of us want to keep our system public. And so we really need to think about ways to improve simple changes. So now your chance to have a little bit of fun. Oh, before that, I just wanted to point out that if we go back to the health literacy predictors, culture plays a role here. The fellow who had that cleanse, it was a gym buff. And to him, the word cleanse was associated with a detox. And so he didn't think of it as cleaning your body. He thought of it as a juice cleanse. There's also his knowledge, his ability to ask questions. Maybe he was like, does she mean cleanse or does she mean cleanse? And maybe he didn't ask because he didn't feel comfortable. But then there's also provider factors. She, the nurse, could have done that better if she had used plain language. And on that note, a couple minutes with the person beside you, just have a conversation about what you think she could have done better, that nurse could have done better to improve that communication. And then we'll hear from a couple of you what your thoughts are. It might not be 5 minutes, maybe 2 minutes. See how much time you need. So that wasn't even 2 minutes, but what do you think? Was that enough time? Have you got some ideas? Was that enough time? Was that enough time? Yeah? Okay, let's come back together and hear from a couple of you. Does anybody want to share some suggestions to improve that communication? Yeah, please. Yeah, what would the label say? Soap. It's pretty simple. And the use of repeat back or teach back is a really great suggestion. Teach back, does everyone know what teach back is? Have you heard of it before? I don't see very many nods, so it's basically what it sounds like. It's when you ask someone to repeat back in their own words the instruction you just gave them. But if someone is truly a master of teach back in healthcare, they'll say, I want to make sure I didn't forget anything. Tell me in your own words what I've just asked you to do. That way you take the pride, or you take the onus off the patient to use the proper medical terms, and if they forgot something, maybe it's because you forgot to tell them. So it's a little bit of preserving pride and dignity. But that's a great suggestion. Any other ideas, please?
Tell them why you need to take it. Because if they needed to cleanse their system, then yeah, they would drink it. But if it's to cleanse their body and prepare for surgery, then they have to wait.
Yeah, that's a really good point. I'll repeat it in case the people in the back didn't hear. So she said to explain why. If you include a description of why someone needs to do something, then it will help to demystify it or clarify it. Any other suggestions? Please. Yeah. That's a really good point. Did everybody hear that? And, you know, it makes me think about when so maybe at the moment he's like, yeah, I can cleanse my body with that in the morning. But then when he opened it and he went, and then when he went, that tastes like soap. If there was a phone number, he could have checked. Say, I thought I was supposed to drink this, but it really smells soapy. So that's a really good suggestion. So these are all really simple suggestions, really great suggestions, really simple to enact. And they would have saved a significant amount of money if even one of those had been used. And he would have had his surgery. He wouldn't have been embarrassed. Would have been a much happier story. So just a really simple story that I hope will stay with you and you can share with other people. This is just a little bit of an example about a couple of the things that you said. Explain why. Wash your body with this soap. This soap will reduce the amount of germs on your skin. Less germs will reduce your risk of infection. There's an image of a person showering. It would be great if the bottle said soap on it. It'd be great if there was a phone number on that instruction too. So thank you for participating. So plain language, you're kind of exposed to it already. So plain language, cleanse your body with this fluid. That sounds pretty simple. In fact, if you look at plain language, if there are words that are less than 2 syllables, then you're basically below grade 6. And grade 6 is the grade level you want to aim for in plain language communication. So cleanse your body with this fluid. Nothing's more than 1 syllable, or fluid is 2, but nothing over 3 syllables. The other best practice is not to have more than 10 words in a sentence. There's not more than 10 words in that sentence, but it was still vague. And that really gets at the difference in plain language review. There's 2 parts. So first is the content review. What does it say? Is there nuance? Are there words that have double meaning? Is it unclear? And that's really asking the why. And then there's the mechanical review, which is looking at things like how many words are in that sentence and how many syllables are in the words. And then how many sentences are in that paragraph. So there's sort of 2 parts to plain language, and it's the kind of thing that as you start noticing it, you can build up a real level of expertise with it. But those are the total simple breakdown of it. So plain language is an evidence-based approach to providing clear and accurate information. Plain language is communication that you understand the very first time you hear, read, or see it. So it's just very straightforward. So when we're talking about content review, it's, here we go. It's really asking yourself, it's an intervention into the logic. So if you're trying to look at a paragraph or you're looking at consent forms, how many of you are recruiting patients for research studies? Do you find the consent forms could potentially use a plain language review? So even if the consent form is complicated, in your communication to patients, you can perfect your spiel. So you can think about, who is this information for? Who are these people? Why would they need to know about this study? Why would they want to participate in this study? And what do they need to know about it in order to make a decision? And if you can really narrow that down, then you can have a nice sort of your content be nice and clean for plain language communication. And then there's the mechanical part of it, and that's the part in counting sentences and that kind of thing. And so plain language uses grammatically correct complete sentences, and it uses the right words and the right images to convey information. It tells a reader exactly what they need to know without using extra words. Do you ever read articles from the New Yorker magazine? Well, if you ever read articles that are really well written, something you just really blogs or some other sites that you really enjoy reading, I bet they're written almost in plain language because it's a pleasure. You don't have to read the sentence twice. You read the article once and you've got it. And that's excellent writing, and that's usually plain language. Sometimes there's a complicated word in there, but plain language uses everyday words except when technical terms are absolutely necessary. And when they are, so if you have to say oncologist, because people who are in the cancer system are going to hear oncologist, 4 syllables, too long. But you need to use it. They're going to hear it. They need to know what an oncologist is. You would just put in brackets, cancer doctor. So you can still use technical terms if you need to, but they need to be explained. And then uses personal pronouns, the active voice, logical organization, and then design features to create white space like bullets, and clean designs. Plain language is not writing less precisely. It's that vague vague message that is confusing. It's not dumbing down. Sometimes people think plain language is dumbing it down. It's not. It's actually smarting it up if you think about it, because you really need to think about what you're trying to say and say it really clearly and specifically so people can't misinterpret it. It's not an attempt to be folksy or informal. In fact, you don't use contractions, so you wouldn't say can't. You wouldn't write can't. You would say write cannot, things like that. And it's not leaving out unnecessary technical terms. Sometimes when someone first tries to write in plain language, what they're trying to develop ends up being a little bit superficial because they struggled with some of the difficult technical things. But if you leave that out, that's not plain language. Please.
So you don't think that the patients would see the healthcare provider as less professional?
No, it's a really good question, and it's actually quite the opposite. The literature shows that if health providers speak and communicate in plain language, so in ways that you understand easily without struggling to get it, you actually build up a better, trusting therapeutic relationship. There's a lot of distrust of health providers, a lot of distrust of pharmaceutical companies. A significant reason for that is a lack of understanding. And so people think, oh, they're not being transparent with me. They're not telling me straight. And it can influence the relationship. So plain language actually improves the relationship.
We were discussing, me and Sandra, about the example. She said that instead of using the word cleanse, I think like wash your body.
Yeah.
It's more basic than the word itself.
Yes, absolutely. Yeah, wash is clear. The other thing, if you think about it, with cancer patients, it's a really complicated disease. The treatments are really complex. The words are really complex. And when you're dealing with a diagnosis of cancer or you're going through really pretty harsh toxic treatments, you're really not at your best. So even if you are able to understand very technical words, when you're sick, when you're overwhelmed, when you have other things going on, you don't want to have to struggle. You want it simple. I actually always want it simple, even when I'm at my best. That's why I like Apple products over Android, but yeah. This is just a few of complicated words that come up in cancer. These are words that you hear every day when you work at Princess Margaret. Most patients don't know what these words mean. Most people don't know what these words mean. Did you know that most people, I can't remember the statistic, I think it's 80% of people don't know what tumor means? Tumor is used every day at Princess Margaret. Do you know how many cancer patients don't know they have cancer? A significant number because of the words. So here are a couple examples. Now, I wanted to ask you guys to read these out loud, but it needs to be someone who can actually see it. So there's 3 examples. First is taken from a consent form. This is an excerpt of regular, normal health language. And then there's 2 other ones as we take the grade level down, just to show you the difference in grade level. So who can see this and wouldn't mind reading it out loud? If nobody can see it, I can read it. Oh, you can? Okay, please. Oh, you can see from there? That's impressive.
You voluntarily consent to participate in this research investigation. You may refuse to participate in this investigation or withdraw your consent and discontinue participation in this study without penalty and without affecting your future care or your ability to receive alternative medical treatment at the university.
Okay, thank you. And that is a college reading level. Who wants to read the next one? Who can see it? Impress us with your eyes. Can nobody else see it? Jared, can you see it way back there? You can see that?
Participation in the study is entirely voluntary. You have the right to leave the study at any time. Leaving the study will not result in any penalty or loss of or benefits to which you are.
Well done. And that's a grade 8 reading level. Okay, and now for the last one. Any takers for this one? Do you want to read this one?
Sure.
Oh.
You do not have to be in this research study. You can agree to be in the study now and change your mind later. Your
All right, thank you. And that's 4th grade. Which one do you like the best? So show of hands for those who like the first one the best. Okay, show of hands for the second. Yeah. Show of hands for the third. So most people prefer grade 4. That's the gold standard target. In the U.S., it's grade 4. In Canada, it's under grade 6, where we try to aim. If you think about what I was saying about actually your question about trust and the relationship between the healthcare provider and the patient, if you have to read a consent form and they're not one paragraph, they're 20 pages, do you feel like maybe someone's trying to trick you or something is hidden in there that maybe you don't understand? What if it's written like this? There's no mystery. You understand it. And you can truly agree or not agree to participate in a study and be informed. There's a lot of data in health literacy research that talks about retention in clinical trials. And when consent forms are actually written in plain language and patients actually understand what they're committing to, they're more likely to stay on, of course. Makes sense. So there is sort of a movement in research to promote plain language, but we're very far away from that. So eHealth literacy. eHealth literacy is almost exactly the same as health literacy, except it's talking about the digital environment. So eHealth literacy is focused on patient and provider skills in finding, collecting, using, and validating the quality of digital health information. And it takes into account your skills and abilities, as well as the demands of complexity of the digital environment. So if you think about Google, let's say someone gets diagnosed with cervical cancer, and what is cervical cancer? How did I get it? And their mind is swimming, and they go to Google and they type in cervical cancer. How many of you feel like you would be able to judge whether the information you're looking at online was from a reputable source? Not even half. So that's, and you guys are probably way more web savvy than the vast majority of people, especially people who are of the age of most cancer cases. So most people can't judge the quality of health information online. And interestingly, the grade level, the reading level of information online is on average grade 14. So it's even higher than the average for print, which is grade 12 on average. So for people who need to find information online, it's very difficult for them to do. So what do you think are some eHealth literacy challenges? I don't know, just anything that you can think of.
Basically, access. For some, majority of them of the age, a lot of the time, like, they don't know how to access an internet or a computer, or if they do, they don't know how to navigate through it.
Yeah, that's true. I don't know about your parents, but if someone closes their Gmail, there's no way they can get back into it. No way. What are some other? Please. Yeah, I think you're right. Yeah.
There's like a lot of contradictions online between like different sources, and they don't know what to believe. So they're very confused.
Yeah, it's very hard to know specifically what would apply to you. So that kind of touches on health literacy, but then also the huge swarms of information available on the internet and trying to negotiate which are the ones that are most applicable or useful to you. Too. Any other?
Use of keywords.
Yeah.
Like I should mention malignancy, tumor, and cancer. Different types.
That's right. If you wanted to find high quality information, it's probably written in high level language. And so then you need to be able to actually spell those words and actually know what they mean in order to use them. And then also to interpret what you're reading. Mm-hmm. Yeah.
Just kind of a side note on the topic of like patient access now to test results.
Yeah.
Total other can of worms in terms of actually understanding those results prior to meeting with your clinician, and then having more, almost like she said, like wealth of information, but maybe too much.
Yeah. Yeah, that's a really good point. The patient portal is wonderful at UHN, but you do have to have pretty high digital health literacy in order to navigate that. My partner's mom was recently diagnosed with cancer, and she had access to the portal. And she has a Mac. She's pretty web savvy. She does her own taxes online using TurboTax. Like, she's pretty good in terms of digital health literacy or digital literacy. She could not figure out the portal. She needed to add me so that I would have access so I could see when her appointments were, so I could nip over to PMH and make sure she was okay and be an extra set of ears and all that. She could not figure out how to add me to her portal. I had to do it with her. I think I've actually added myself 2 or 3 different times because she keeps accidentally changing the expiry date. I think it's an accident. So, yeah, I think that's a really key point. So there's all of this information, there's all these resources available, but do you have the right words to find it? Do you have the skills to interpret and actually use it and know if it's applicable to you? And can you actually physically use it? I think one of the things that we find is that example I provided earlier about someone who drops a pamphlet in a puddle or loses it, but it had all of their instructions on it for their next appointment, they can't get it. They simply can't get it most of the time. And if you look for health information on our website at Princess Margaret, good luck. I challenge you to find the sitz bath pamphlet. See if you can find it. Our group has done a lot of work in trying to improve digital health literacy or develop strategies to help patients find information better. And I can tell you more about that. But one of them that I really would love you to know about is Cancer Answers. Cancer Answers is a search engine that our group developed. It's meant to be sort of a cancer Google. We developed it by observing patients in the library and looking at how they looked for information. So you guys are all reasonably new in cancer, I think, as summer students, unless you're here for a few years. But would you even think that there was a volunteer service to drive you to your appointments for free? Would you even imagine that there's a child care facility on site so that when you go for your radiation or your chemo, someone's looking after your little ones and entertaining them with stories and books? Why would you ever imagine such a thing existed? So how can you find out about it? It kind of has to be served up to you in a certain way, especially when you're already overwhelmed and probably very worried about the treatments and the side effects. So we observed patients to figure out we conducted an ethnography to see how patients were asking for and interacting with the library collection. And then we did some card sorting activities. So we gave a bunch of patients cards that had the names of resources, pamphlets or books on them, and they had to sort them into piles that they thought made sense, group things together, and then label them. So we wanted to see what words they used to describe these resources. And then we developed Cancer Answers based on everything that we learned about how patients search for information. So there's 5 different personas of information seekers that we found out there for low health literate information seekers. There's I've lost them all. There's the window shopper, which is exactly what it sounds like. They just want to look and see what's there and then maybe find things. There's the collector. Give me everything you have on breast cancer. And they just want it all. There's a number of different ones. And so all of those different ways of searching for information we've tried to reflect that in the interface on Cancer Answers. So if you were to Google Princess Margaret Cancer Answers and you wanted to find a resource on any cancer-related topic, we hope you could find it. So if that comes up in any of your placements, you're talking to patients, they're asking for information, you can tell them about Cancer Answers. All the staff at Princess Margaret love it because it helps them find things easier than using our website. So that's just a little bit of a digression, but there's a number of digital innovations we do here. My twin sister's portfolio, Tina Papadakos, she focuses very specifically on digital health literate design and has done a great deal of work in that area. So if anyone's curious about that, feel free to reach out to us and we can tell you more. These are just some of the challenges that you mentioned when we were talking about challenges with digital health literacy. A large amount of information online can cause information overload. There's so much you just end up closing it. I think that's what you had mentioned. Patients don't feel equipped to assess the quality or the credibility of the resources they see online. And then the language level on the web is far above the recommended grade 6. And then there's a discordance between the design of most health information websites and the approach that patients take to access information. So this is, we're getting toward the end of my presentation, but I wanted to talk to you about universal precautions. So I kind of had said before, let's just assume everyone has low health literacy because most people do. And even if you don't, why wouldn't you want it to be simple? Especially when you're sick and probably scared. So universal precautions, those of you who work in wet labs, you might think of it when you're wearing masks, gowns, gloves. In healthcare, that's a universal precaution. You're protecting yourself from germs or other airborne diseases and whatever. But in health literacy, it means assume everyone has low health literacy and assume everybody would like things simple, because you're probably right. And it's taking specific actions that minimize the risk for everyone when it is unclear who would be affected. So in a survey of spouses, I guess I'll just say it this way. 60% of married couples, if one of the two partners, can't read, only 60% of them know that. So if you can hide from your spouse that you can't read, you're going to hide it from your doctor or your nurse. So, because people are really embarrassed if they can't read, so they hide it. So if you try to find out, do you have low health literacy? Are you comfortable reading this form? People will go to great lengths to say that they're okay, that they can read. They forgot their glasses, they're too tired, they have a migraine, lots of excuses. The point is, though, don't ask. It's embarrassing. It's better just to assume everyone would like the information simple. So clear communication practices, removing literacy-related barriers, using plain language improves outcomes for all patients, regardless of their literacy level. And we have this wonderful colleague here, Jen Deering. She's a nurse practitioner at Princess Margaret, and she runs the radiation nursing clinic. She is incredible, and she has told us this story about a patient she had, and it was just the most perfect story to help you remember universal precautions. So rather than me tell you her story, let's watch her tell it.
I work with head and neck oncology patients who are on concurrent chemo radiation therapy. And I see these patients in a clinic where they can drop in if they're having problems with side effects from treatment. And one day a gentleman came in very unwell. He was 7 to 9 days after his first dose of high-dose cisplatin. He had severe nausea and vomiting, and he clearly was dehydrated. And upon questioning of him, he had not taken his standing anti-nauseas that were prescribed or the as-needed ones. And when we did further investigations, we found him to be quite hypotensive, and he actually was in acute renal failure at the time. So we brought him into the clinic, and I hydrated him and gave him the anti-nauseas and sorted him out. And as I was going through his history, I read that he is actually a very prominent physician. And I thought, this is quite odd, because how did this physician end up in this situation where he didn't take the prescribed medications? So when he was feeling better, I sat down with him and I said, tell me what happened. I want to make sure this doesn't happen to you again going forward. And he said to me, Jennifer, I'm 40 years old. I was just made chief of my department, and I got diagnosed with my cancer. And he said, so my career had to be put on hold. My wife, who was expecting our first child, went into premature labor, and my newborn son is in the neonatal ICU. He says, my life is just spiraling out of control. And then he says to me, I'm being treated like I know everything. And he recognized that people were being well-intentioned because he's a doctor. But he said to me, I just need to be treated like I'm a patient. I'm a doctor. I'm not an oncologist, he says. And people just assume, I know all the treatments, I know all the meds, I know what to do. And he says, at this point in my life, I just cannot manage this. Because normally in my day-to-day workings, I would be fine with this, but I need some help, and I want to be treated like a patient. And I said to him, I hear you. This was the first time I had met him. But what I had done then is went and spoke to his medical team and said, look, this is what's going on. And going forward, we treated him just as you would as anyone else. So this patient had seen many healthcare providers before, and he had never shared this with them. And I'm not sure why he did with me, but having thought back on the situation, I wonder if it's because I sat down and just talked to him like I would any other patient. And it really gave him the chance to open up and talk with me. And I think with this scenario, it's really important because it highlights universal precautions with education. It doesn't matter the person's education background, their career or status in life. You still need to provide clear and simple instructions to the patient.
Okay, so that's Jen Deering. You can say hello to her in the RNC on 2B at Princess Margaret. This slide is really just to say you can't tell who has low health literacy. Even the people with low health literacy can be really intelligent, really well-dressed, really successful. You can't tell. Don't try to tell. Use universal precautions. Even if you can tell, you're probably going to miss by treating people, speaking in a way that people actually just would prefer it simple anyway, like the story Jen shared with that doctor. So this is what that's meant to do. And I just want to acknowledge that this presentation is something that my sister and I have put together together over the years. So I just want to acknowledge her and take any questions you have.